Bob, we had in the newspaper review the main story was this Wes Streeting attacking the health unions. Can you give us your response to that?
Hi, Crispin. Yeah, so, if anybody was still under any illusion that Labour were the party of the NHS, well, that article spells it out pretty clearly. What Wes Streeting is doing is telling the private investors who are increasingly controlling the NHS that they are safe under Labour. What he doesn't say is the wage demands of the NHS staff are a call for a restoration of the wage suppression that has taken place over the last decade for the reasons that Prem outlined. We bailed out the banks and the workers have paid for the bailout. So in effect, we've had a wealth transfer out of working class pockets into the pockets of the banks. But Wes Streeting isn't making that analysis. So what he's actually doing is punching down. He's punching the people who need the wage increases just to stop the hemorrhage of staff out of the NHS. Now, to work in the NHS, particularly the acute services, it's extremely difficult because you have very high demand, you have limited bed capacity, and you don't have enough staff. So those people are under immense pressure, and they can see their colleagues exiting out of the NHS because their colleagues cannot afford to sustain themselves financially, on top of which they have the huge psychological burden of working under such conditions. Now, in terms of the unions, the reason the NHS staff, the doctors and the nurses, are in such a position is because the unions have been horizontal. They have given no resistance to the attacks on the terms and conditions. They haven't stood up, and now they would look conspicuously incompetent if they didn't back the demands for wage increases. So I know my union, the British Medical Association, was a signatory to the Health and Care Act that went through Parliament in July. They signed the white paper, which effectively breaks up the NHS, gets rid of national bargaining, and allows for antisocial working hours to be paid at normal hours rate, and removes something was called automatic pay progression. The BMA signed up to that. The BMA promoted a contract that condemned doctors across the country to worse terms and conditions. So the good news is there is an internal struggle within the BMA of some trustworthy doctors within the junior doctor committee that I'm aware of who are pushing back. And I'm just hoping that, our unions don't sabotage the industrial action that is planned. And another point to make is the RCN, the Royal College of Nurses, who have had this historic vote, are refusing to coordinate strike action. So this doesn't make any sense to me. I don't know what their rationale is, but I do not trust the union leadership. So that's what it boils down to. But what is even more interesting is the arguments Wes Streeting isn't making. He isn't making the argument that there's enough money within the NHS, but it's going out the back door to service private finance initiative debt and the cost of running this market, which is estimated at around 20% of NHS budget now, is just going on running the NHS and the marketized NHS. The other point he isn't making is there is no spare capacity in the private sector. We have a limited pool of healthcare professionals in this country, and the private sector is run on people who moonlight in private healthcare. And when you have a limited pool and you have worsening conditions in the NHS, you're encouraging a drift out of the NHS into the private sector. So you further destabilize the NHS. So his proposal is madness. And the other point he doesn't make is an investment in healthcare has something called the economic multiplier effect. For every pound you spend in healthcare, you deliver 4 or 5 back into the economy. Unlike the banks that we have bailed out to astronomical amounts that I can't even get my head around, that Prem outlined, money invested in healthcare returns people to work, and the money paid in salaries is again recirculated into the economy. So Wes Streeting has no concept of how the NHS works, has no concept on the limitations of his proposals, and is economically ignorant.
Yeah, I mean, I just want to say I keep getting you on the show almost every other week now because he keeps coming out with stuff. I mean, do you think he would be one of the most disastrous health secretaries ever?
Well, I think we're putting too much power on individuals. The people running the health service aren't these politicians. They're the big four accountancy firms, management consultants, and the City of London. They drive policy. And we get, you know, we're handed one puppet after the other. These people aren't calling the shots. They are reading a script written by their political advisors who are part of the privatization lobby. And they just have to learn how to perform it convincingly. That's what we have. So whether it's Wes Streeting or some other City of London shill, it doesn't matter. The policy remains the same.